Hello everybody, and welcome to the Total Joint Preoperative Education Seminar. My name is Gina Morris, and I am the Advanced Practice Nurse here at St. Barnabas Medical Center for the Orthopedic Department. A little bit about me is I have been with the institution for over 2 years now. I am an orthopedic certified nurse, and I assist the surgeons in your care while you're in the hospital. I am going to educate you on everything from what happens before surgery, during your hospital stay, and when you return home. Some other content is how to prepare for surgery, what to expect after surgery, recognizing and preventing complications, and staying active after surgery. So, the number one thing on your to-do list before you arrive to the hospital is to enlist a coach. Now, this means somebody that's going to be there for you with anything that you may need help with. This could be a family member, a close friend, maybe even a neighbor. And they will be there just to pick you up from surgery, be a second set of ears in case any information needs to be given that you just want somebody else to listen to. And when you go home, if you need an appointment, a ride to your doctor's appointment, things in that nature. Currently, your loved ones are not allowed to wait in our waiting area. However, we will call them as soon as your operation is over and they can come and visit you on the unit. Another thing to do as it relates to your home is setting up your home so that you have a good environment for when you arrive after surgery. This means picking up all of the throw rugs so that you don't trip and fall, having good lighting so that you can see at nighttime when you get up and maybe go to the bathroom. One other thing that's important is to maybe have some meals planned ahead of time. This will help so that you don't have to stand and cook in the kitchen, because the first few days after surgery, you may be in a little bit of pain and it may be hard to stand on that leg for longer periods of time. One of the things that you will need to do before surgery that you are told in your doctor's office is pre-admission testing. This is just to make sure that you're optimized for surgery. What happens during this pre-admission testing is that you will get your lab work done. You will get an EKG. If necessary, you will get cardiac clearance. This is only if needed, and your doctor will let you know. And then you will also need to get COVID tested. This will be indicated by your doctor's office, and they will explain to you how many days before surgery you need to get the COVID test and where to go for this test. You should expect a phone call 1 to 2 days before the actual day of your COVID test. This way you're prepared to come in. You really want to tell your surgeon if you have any cuts or infections, just so that they know ahead of time, because if you do, they may even cancel your surgery. So this is something that you want to report before the day you come in. Also refrain from shaving starting 48 hours prior to surgery. The open hair follicles can cause infection, and that's something that we don't want as well. Here at the hospital, we do use a multimodal pain management approach, which really means that we use many different medications in many different ways to help control your pain in order to reduce narcotic use. This is used by many hospitals across the nation, and this involves also taking medications prior to surgery that target different types of pain. We want to target things such as inflammation, nerve pain, and if you come to pre-admission testing here at the hospital, we will make sure that you get these medications to take the night before and the morning of that you come to surgery. This medication can be picked up when you come to the pre-admission testing department, and your masks must be worn at all times when you arrive to the hospital. The goal with the multimodal pain management approach is to control pain early to reduce recovery pain. If we are able to get some medications into you before you have surgery, then we won't need to play catch up after surgery, and then we can just continue to control your pain. And we do send you home on a lot of these medications as well to continue your regimen so that you're comfortable after surgery. Now, this regimen is tailored to each individual, and we will adjust accordingly. So the night before surgery, usually you will take 1 capsule of Lyrica, and that's 50 milligrams. This is to help with nerve pain. You take 2 tablets of Tylenol. This is an extra strength Tylenol, 500 milligrams each, which equals 1,000 milligrams. The morning of surgery, you take another Lyrica capsule, 50 milligrams, and another 2 tablets of 500 milligrams of the Tylenol. We also ask the morning of surgery that you take 1 capsule of Celebrex, which is 200 milligrams. Now, not every patient will be taking all of these medications, and like I said, this will be tailored to each individual. These are just the medications that we have on our pain regimen list. We want you, the morning of surgery, we want you to take these medications with water. We only ask that you drink 8 ounces, 1 small glass, nothing more, because there is a chance that if you drink more than that, they can cancel your surgery if the anesthesia approach changes. So please only take 1 8-ounce of water with your medications. Do not take with food. We do not want you to eat after midnight from the morning of surgery. Now, some side effects of these medications, the Lyrica for nerve pain can cause some drowsiness, some blurred vision, dry mouth, difficulty concentrating. Tylenol is usually well tolerated by all, so we really don't see too many side effects with this Tylenol. And Celebrex. Celebrex can cause some dizziness, some nausea, some constipation or diarrhea, heartburn, or abdominal pain. So like I said, we will tailor this to your individual needs. You will get something called a scopolamine patch. This usually is also tailored to the individual based on age, because it can cause some drowsiness, blurred vision, difficulty urinating, and some dry mouth. So what this is, it's applied externally behind the ear on the morning of surgery, and it helps reduce nausea from anesthesia. The patch is typically removed 24 hours after surgery, so we will remove it the morning after. Most of these medications can be collected at the retail pharmacy that we have here in our East Wing. The pre-admission testing department can send your medications there, and you pick them up when you get your pre-admission testing done here. If you get your pre-admission testing done elsewhere, we can communicate to your doctor's offices the certain types of medications that you need, and you'll be able to possibly pick them up at your pharmacy. We do have services such as bedside medication delivery. If after surgery your medications are sent to the pharmacy here, they do accept all major health insurance plans. However, for personal questions about your medications, please, you can speak to our pharmacist or you can call us directly or your doctor. So now, medication instructions. What is generally acceptable to continue taking the morning of surgery? We usually say to limit vitamins and minerals. They should only be taken as prescribed by your physician or your nurse practitioner in the office. There are some vitamins we want you to stay away from because they can cause blood thinning, such as garlic, ginkgo, St. John's wort, things of that nature. But what's usually acceptable to continue taking are your blood pressure and heart medications, thyroid medications, and sometimes cholesterol medications. But you do want to check with your surgeon or your primary care doctor before you come into the hospital. We also want you to check with your physician regarding when to stop any blood thinners. This might be Eliquis, Xarelto, even aspirin. Usually these are stopped within a week before surgery, but again, we would like you to check with your surgeon. This is important because we don't want you to come in and have surgery and it could cause a little bit of extra bleeding. We will restart you on your blood thinners after surgery. What's usually okay to continue taking is just your Tylenols for pain and the Celebrex. Now, what to bring to the hospital? Usually we ask that you bring loose-fitting clothing such as shorts, sweatpants, maybe a bathrobe. For women, you can wear the same items. Sometimes a loose-fitting throw-over-the-head dress helps. This just helps so we can get to your incision if we need to. And it's loose. You can move around. It's easier to do physical therapy, go to the bathroom. Footwear, we ask that you bring a good walking shoe or sneaker, no flip-flops or open-toed shoes because we don't want you to fall. In regards to dental appliances or dentures, We ask that you don't wear them the morning of surgery because they will need to be taken out. However, we do want you to pack them away in your belongings bag so that you can eat after surgery. Glasses are preferred. We don't want you to wear contact lenses the day of surgery. We will have to ask you to take them out. Hearing aids, please bring those as well. You can keep all of these in your personal belongings bag that will be transported to your room after surgery. You can also bring any personal toiletries. We want you to bring your cell phone with its charger so that you can get in touch with family members. If you have a CPAP machine that you need to use at night. We do have free Wi-Fi here for laptops. However, we do ask that you leave large valuable items at home, such as jewelry, large amounts of cash. You can bring a little bit of cash in case you have your medications filled here at the retail pharmacy, because if there is a copay, you may have to pay that before you go home. Bringing a copy of your living will or advance directive if you have one. Not everybody does. You don't necessarily have to, but if you do, we will copy it and put it in our charts. And then lastly, bring a list of all medications you are taking, including the frequency and the last dose that you took it, so we can continue your regimen here at the hospital and you don't miss any of your important medications. For our total hip patients, we will talk about a hip kit. So now these are items that will help you get dressed, put on your shoes, pick things up off the floor. If you ordered this prior to surgery and you would like to bring it, occupational therapy here in the hospital will see you and they will show you how to use it. They do have their own equipment, but if you'd like to bring yours, you're more than welcome to. Now, speaking of total hips, we have two different types of approaches that we do here at the hospital. And one of the approaches does come with precautions. Now, total hip precautions for a posterior lateral approach. We do ask that you do no hip flexion over 90 degrees. This means sitting with your knees lower or at your hip level. No bending forward, especially when sitting or picking things up off the floor. And no flexing your operative leg up while sitting. So this means no sitting low on a toilet bowl. We will give you a raised toilet seat to go home with if you do have hip precautions so that you don't sit too low. We also ask that you don't do any inward rotation of your hip or turning your legs in pigeon-toed. We also ask that you don't cross your legs at the ankle or at the midline if you do have these precautions. Breaking these precautions can all result in a hip dislocation. Physical therapy will go over these precautions with you when they see you on the day of surgery. And then occupational therapy will see you as well to teach you how to get dressed and do your activities of daily living without breaking these precautions. The adaptive equipment that I spoke about a little bit earlier should be obtained by you prior to your scheduled surgery date. This is called a hip kit. It can be bought from the retail pharmacy downstairs after your pre-admission testing, or you can get them on Amazon, and Walmart has them as well. Please keep in mind that it might take a little while to come in through the mail, so we would like you to order them in advance. Some of these items include a long-handled reacher to pick things up off the floor, a sock aid, a shoe horn to help put your shoe on so you don't have to bend over, a long-handled sponge so that you can wash your feet in the shower, and a dressing stick. This will help you put your pants on so that you don't break any of your precautions. And like I said, occupational therapy will be here to teach you how to use all of these items. Now, if you don't have any of these hip precautions, we will also let you know. It's based on surgeon. This will be an anterior hip approach. And you won't have precautions, and you will be able to move about a little bit more freely. Now, this is just depending on surgeon preference and what they decide to do based on your tailored approach. The day before surgery. Now, You will receive a call from the same-day surgery center the evening before regarding the time and location of your surgery. Unfortunately, calls don't begin until 4 p.m., and they do communicate with you up until 9 p.m. So if you don't get a call during the day before surgery, don't worry. Just please expect that phone call more towards the evening. The number to reach same-day surgery is 973-322-5130. Just in case you do not receive any communication, please call them to follow up. The day before surgery, it's important to eat an early, healthy, balanced meal the evening before, unless other directed by your surgeon. Usually we ask that you stop eating at midnight. You may drink a small glass of water, like a little juice glass, up until the morning of surgery. This is only 8 ounces of water before you leave the house to take with you some of your medications or if you're just thirsty. Avoid smoking the day before and the day after surgery. Please seek assistance to try and stop smoking prior to your surgery. This is very important for proper wound healing. Also, we ask that you stop the consumption of alcoholic beverages. If you feel that this may be a problem, please consult your surgeon. We provide here in the pre-admission testing department a chlorhexidine gluconate body rinse. If you don't come here for your pre-admission testing, they do have these at your local pharmacy or CVS. If you can't find it, you can just use Dial soap. This is a prep rinse. It's to safeguard against any surgical site infections. And all patients are required to use this rinse the night before surgery and the morning of your surgery. What we ask that you do is wash your body normally with your soap and then rinse. After you wash your body, please use this prep rinse afterwards. When you do arrive to the hospital, they will do what is called a nose-to-toes process. This consists of disinfecting wipes, an oral rinse, and a nasal swab. These are all measures just to prevent any infection. We have some bacteria that lives on our skin, so we like to prep our bodies before surgery to prevent as much infection as possible. Now, what to expect in the hospital after surgery? We try to control your pain the best to our ability. Now, you will have some pain. Most of the time, you won't be at a 0, but we want to make your pain tolerable. When I say tolerable, that means that you can get up, you can do physical therapy, you can walk to the bathroom, and that you're comfortable. What I ask is that you don't be a hero. Be honest about your pain levels and stay ahead of your pain. The nursing staff here is great, and we will be asking you every few hours to rate your pain from a scale of 0 to 10. We do have medications to give you as needed based on your pain levels. We ask that you don't let us know that you're in pain when you're at a 10, because then it's harder to catch up with your pain regimen, and it takes a little bit longer to get you comfortable. Another intervention that we do here is a nerve block. This is dependent on surgeon preference, as well as the patient. It is a local anesthetic that's injected near the nerve and will provide numbness to alleviate all potential discomfort. After surgery, we do give you something called an incentive spirometer. This is to help open up your lungs and prevent any types of pneumonia. Sometimes when you're sitting or laying for too long, which is not the goal after surgery, we want you up and moving, but the incentive spirometer just helps to take nice deep breaths so that you open up your lungs and get rid of any of the fluid that might be in there. Other tips is we do want you to rest. You may eat or drink when you feel ready. You might be a little nauseous after anesthesia. However, that does resolve. And we do have medication agents to help if you do become nauseous. We do expect that you are up and out of bed the next day after surgery at 7 a.m. in the chair to be prepared for the day ahead. Most of our patients do go home the next day after surgery, so just be prepared for that. You will get up with physical therapy the day of surgery. This means you wake up and physical therapy comes to your room and you start to walk. Walking is very important. It does prevent a lot of complications such as blood clots, and we will get into that a little bit later. So now, on postoperative day 1 and 2, these are the days after surgery. You will most likely only be here for postoperative day 1. However, you will have blood work and vital signs done early in the morning. Like I said before, you're out of the bed and in the recliner by 7 a.m., ready for the day ahead. Functional therapy sessions to ensure a safe return home. Physical therapy will assess you to make sure that you are able to walk properly, are able to climb stairs, and get in and out of a car. This is all important so that you know how to do this and that you are safe before you return home. There are 2 places where we send our patients. One is the orthopedic unit on 4 West, and one is the EPA unit. This is the enhanced patient area. Sometimes we send patients to our enhanced patient area if you're a rock star and you're ready to go home bright and early on the next morning. You will receive physical therapy on day 0 and early on postoperative day 1 prior to discharge. Now, physical therapy will come to your house after surgery. We will arrange for that. And if we feel that you don't need therapy at home, we will give you a prescription to go to an outpatient physical therapist department. This will all be discussed with your surgeon. Now, discharge planning starts the day you arrive. The goal is to discharge home the next day, like I said before, and have someone available to drive you home from the hospital and to help you at home. This is when we discussed about enlisting a coach. Patients leaving on postoperative day 1 can expect a little bit later of a discharge if you need to do 2 physical therapy sessions. This could usually be around 2 or 3 p.m. If you only need 1 physical therapy session the next day, you can expect to leave at 12 o'clock. Patients leaving on day 2, if you need to stay another day, sometimes there are complications and we do have to keep patients an extra day. Patients that are leaving on day 2 can anticipate a time around 11 to 12 a.m. Equipment needs will be addressed by therapists and case management. We do have a case manager that comes to give you things that you may need at home, such as walkers, commodes, and they will discuss with you about your home environment and physical therapy coming to your house. Please schedule a post-surgical follow-up with your surgeon no longer than 2 weeks after surgery, as well as your primary care physician. For patients who will be going directly to outpatient physical therapy, just 2 recommendations. We have 2 locations near the hospital. The Ambulatory Care Center has a physical therapy department, which is at 200 South Orange Avenue in Livingston, as well as 120 Milburn Ave in Milburn, New Jersey. So our home recovery program, this is a program that allows you to gain your strength and independence while in the comfort of your own home. A member of our home care team, this will be the case manager, will be contacting you in the hospital in regards to this service. Usually a visiting nurse and a physical therapist will come to your house about 3 to 5 times a week. Now, I want to talk to you about recognizing and preventing complications. Some potential complications which we really would like to eliminate are blood clots, infections, pneumonia, and any hip dislocations. Blood clots. The signs and symptoms of a blood clot are swelling in the calf or thigh that do not go away. It's pain or tenderness that when you touch it or not touch it, you feel pain, maybe some redness in that calf area. That could be a complication after surgery, and if you do feel any of that, you would want to let your surgeon know right away. We will be assessing you in the hospital for any signs of calf pain as well. The ways that we prevent blood clots here, we use something called a Flowtron machine. It's a device that goes around your leg, and it's kind of like a massager. It pumps and it keeps the blood flowing while you're not ambulating. getting up and doing physical therapy, performing ankle pumps while you're in the chair. Pumping your ankle allows for the blood to continue to flow and reduce the risk of blood clots. We also provide blood thinners after surgery. This is dependent on the surgeon preference, and it could either be aspirin, Eliquis, or Xarelto. The second complication that can result is a pulmonary embolism. This is a blood clot in the lung. You will feel a sudden chest pain, difficulty breathing, shortness of breath. You might be sweating. You might have an episode where you may pass out, or confusion. If any of this happens while in the hospital, we will be very attentive. And if this happens at home, we ask that you call 911. Any signs of infection will be a red incision, increasingly painful joints, increasingly swollen joints. You will have swelling after surgery, but this is a different type of pain. Your swelling and your pain should go down a few days after surgery, and if it doesn't, you would want to let your surgeon know. Any draining of your incision, any temperature elevation greater than 101. You should check your temperature at least twice a day while you're at home, just to monitor for any of these signs of infections. How we prevent it. We do the skin prep and wash prior to surgery. We keep the incision clean, and we keep pets away from your incisions. If a pet gets near your incision and they lick it, this could be a big source of infection. Another complication after surgery may be pneumonia. Signs and symptoms could be coughing, fever, shortness of breath, painful breathing. Prevention is deep breathing. We want you to keep moving, and we do provide you with that incentive spirometer that we spoke of a little bit earlier. Another risk is dislocating your hip. This is why it is very important to follow your hip precautions. You will feel pain, and you may have difficulty ambulating. The total knees don't necessarily need to worry about dislocation, but this next topic you may want to listen in. Discomfort. Stay ahead of your discomfort. Take your medications as needed. We do provide ice. We try and ice as much as possible. And when you go home, we do ask that you continue to ice your knee at least 20 minutes on and 20 minutes off every hour. This will help to reduce some of the swelling and in return reduce your pain. We provide the total knees with ice packs. It is a sleeve that wraps around the knee, and the total hips can just use a generic ice pack and place it right on the site over your clothes. We want you to enjoy your new hip. We don't want you to sleep during the day too much. Keep up with your rehab schedule. Get out and back to normal. We want you to walk around as much as possible. You can climb the steps if you feel comfortable, and you will learn how to do that here in the hospital. You will hear from us after surgery. We will give you a written survey the day of discharge. And this is just how to help us enhance our services. And we want to know how we're doing. We ask that you call us with any questions. We want what's best for you. So if you have any questions, please call 973-322-9543. Thank you very much.